So a question was asked on a thread with a particularly wonderful hypertrophic verruca. And the question was, why did you not poop yourself and refer it to the GP? Which brings us on to a video that I've been meaning to produce for a while, and that is to talk about referoma. A referoma, as in referoma, a growth that you refer, is not something that you will find in any literature because it's something I just made up, but it's a useful concept to think about. When you see a lesion, there is always a question in your mind over what to do with it and whether or not referral is the correct route. But of course, whether or not it's appropriate to refer is not an output of the lesion. It is a product of yourself and your level of expertise and your level of competence in dealing with a lesion like that. So for example, if you are a freshly minted pod or FHP and you see a verruca like that one that I showed, that might very well be outside of your present capability to safely treat, in which case it is a referoma. You might see all sorts of other unusual skin lesions. I had a referoma when I was qualified about a month, and I had a patient come in with a growth on their foot. It was about 5 millimeters across, brown, irregular edges, and when I asked the patient how long it had been there, they didn't know. So for me, that was a referoma. That was something that was appropriate to refer, which in the first instance I did by hollering down the corridor to one of the more experienced pods, who looked at me very oddly, picked up a Black's file, poked it, and it fell off the foot because it was in fact a raisin stuck to the foot. So for that person, it was well within their capabilities to treat, but because I didn't know what the hell it was appropriate for me to refer it. So whether or not you refer something should depend entirely on whether you are comfortable with it, whether you're confident with it. Coming back to the weird verruca, and the reason I was comfortable with that was because I'd seen one before that was exactly like it. A young lad, no risk factors, no reason to suspect it was anything else. Long history of something which was clearly a verruca. That the parent put the caustic on and it went and started doing its Quatermass in the pit thing. So I'd seen it before, I knew what it was, I knew how it was going to progress, which is why I was comfortable just to offload it, keep it comfortable, keep it safe, and didn't feel the need to refer. If you do decide to refer, it's quite important that you do so appropriately to the right person. And as far as skin lesions are concerned, there is a fairly reasonable sort of hierarchy in terms of where you go. If it is likely to be something low risk, as in a 10-year-old who's got a verruca that's done something a bit weird, sending it first of all to a podiatrist, in particular a podiatrist with good experience or knowledge in dermatology, is a good place to start. You can probably do that in private practice very easily if you've made good links with a local pod that you trust, and if you haven't, then do so. GPs are one place you can refer to, but it's not a good idea to refer things to GPs if it's not something that they're likely to be very experienced in. If it is an atypical verruca, then the GP is likely to just give them Salactol and send them home. You can refer to a GP for an assessment by a GP with special interest under the 2-week rule. There is a setup in the NHS where if a lesion meets certain criteria of being suspect, it will be assessed by a GP with special interest, a gypsy, within 2 weeks. That's another good route. If it's some sort of granulomery or fibromery or lipomery type thing, your friendly local podiatric surgeon will be very happy to take referrals from it. They are exceedingly good at cutting out sort of reasonably safe suspect lesions. However, they in their turn will have lesions that they refer. If a podiatric surgeon sees something they suspect to be a malignant melanoma, they will be getting shot of that to the consultant dermatologist. So a referoma is something which is in the eye of the beholder, particularly if you flick it out too aggressively and you don't wear glasses. It is any lesion that you're not comfortable with, and in that case it is always best to refer it. The only thing I would say is try and make sure you refer it to the most appropriate person, because if we just bounce everything to the GPs or bounce everything to the to the consultant dermatologist, they will very quickly get bored of us and stop taking us seriously when we cry wolf and there is a wolf. Consultant dermatologists do not need to be seeing atypical verrucas. They're far too busy with malignant melanomas.